I think so.
Hi, this is Sable Schultz, she, her pronouns. I'm the Director of Transgender Services at the Center on Colfax, and here today we have Dr. Alexis Chavez. Dr. Chavez is a founder of multiple award-winning clinics with focus on LGBTQ mental health and interdisciplinary trans health. She has trained providers across the country to be more competent working with LGBTQ patients. She has held various offices and positions from the local to national level, including treasurer of AGLP, the National Organization for LGBTQ Psychiatrists, medical director of the Trevor Project, member of the Sexual Orientation and Gender Identity Issues Committee of the American Academy of Child and Adolescent Psychiatry, LGBTQ Committee of the Group for Advancement in Psychiatry, and a member of the Board of Directors for the Center on Colfax. She is an APA SAM HSA Fellow, a Power Gala Award winner, and an aunt to a growing number of adorable children. Currently, she serves as the psychiatrist for a newly created LGBTQ specialty service with the VA in Colorado. Dr. Chavez, welcome. How are you doing today?
I'm doing excellent. Thanks for asking. How are you doing, Sable?
I'm doing okay. So originally we had planned an entire panel around bisexual health and health inequities. And so we just kind of have Dr. Chavez today. Dr. Chavez, tell us some of your experiences working with bisexual and pansexual community members.
Definitely. So I think it started probably back even when I was in medical school. That's when I knew even early in my medical career that I wanted to bolster the improving access to care for broadly LGBTQ plus populations. And so I had a lot of both patients that I was serving, but also was very deeply in the community and had a lot of bisexual friends that were mentioning that they were having a lot of difficulty accessing care. They felt like they weren't being seen in the same way. There's the common theme of invisibility. And so I thought, well, what if we could do something better? And so that's where some of my efforts came from for trying to, break down these barriers in access to care with creating mental health clinics with focuses on LGBTQ individuals and other things like that.
Great. So, what are some examples that have come up from community members about the inequities they have faced?
Well, we know that at a broad level, bisexual people, even beyond the general LGBT population, are more likely to have severe psychological distress, or you can imagine just generally not feeling that great. They have higher rates of tobacco use, binge drinking, and it all comes back to, do they feel supported in their lives? Because as a bisexual person, it's a great example of dual identity. And so that sometimes bisexual people might feel that they are 1 foot in the door of the so-called queer community, and they're 1 foot in the door of the straight community, because some of their relationships may be perceived as either straight or gay, rather than, okay, well, these are both bisexual relationships because they're a bisexual person.
And what sort of, in terms of like healthcare experiences, what are some of the challenges that some of the folks that have talked about to you that you can share?
I think the most basic thing is that people have trouble talking about it in healthcare. They have trouble talking about it with any of their doctors. They feel like, well, maybe it's not relevant, or maybe it's really important, and I just don't feel like my doctor would understand. Outside the healthcare space, even people just say very similar things. They feel like it's a part of themselves that they can't really share with a lot of their friends. They can't share with their family. People aren't understanding. And I've had some people really, unfortunately, tell me, gosh, I feel like it would be a lot easier if I came out as gay, but I've tried to come out as bisexual and people just don't get it. They're like, oh, well, let me know when you come out as gay. It's some people, incorrectly think that, oh, bisexual is, let's say, just a phase, or, why don't they just make up their mind between these two? And I think that contributes a lot to this invisibility that we've talked about, is that they are not really sure where they can get this support. And we always know that support is inherently tied to people feeling better about themselves and having a stronger sense of community, being able to just facilitate life easier. And so when you're not able to be yourself, then inherently a lot of these other issues are going to follow.
Yeah, I talk a lot about the necessity for people, the space to be their authentic selves, and how that helps with a lot of mental distress, but also helps other people around you when they can see other people being authentic. In terms of healthcare providers, for the providers out there, what are some of the things that healthcare providers can do to be more accessible to bisexual community members or be more supportive for them?
So one of the things is you have to be explicit about being supportive about these things. It's not enough to say, oh, well, if someone told me, I wouldn't discriminate against them, or I wouldn't kick them out of my office if they came and talked to me about this. No, that doesn't count. You have to explicitly say, you're invited to talk about these things in the office. I think that these are important things about your life, and you're welcome to share these with me too. If you think that I think that these could affect your health in these ways, and in general, even if they don't affect the health screenings that I'm doing, I still think it's important if it's a part of who you are as a person. And so I think that any provider should say, when they're first getting to know somebody, how would you describe your sexual orientation or gender identity? Gender identity isn't bisexuality, but just kind of goes in the same, if we're talking about providers being open to things, just create that space. Maybe there's some signs in the waiting room, or maybe there's some reading materials, that people might find. Maybe there's, out front or things like that.
Mm-hmm. In terms of healthcare resources for physicians and behavioral healthcare providers that specifically want to go deeper into understanding how they can better serve bisexual community members, are there any resources that you would recommend?
Definitely. I think that every year we're becoming a little more fortunate. 10 years ago or more, when I started doing some of this stuff, I couldn't pay people to sit down. I could bring them lunch or anything, and they would just not care, would not sit down 20 minutes to have me talk to them about these things. Whereas fast forward nowadays, a lot of health organizations or even individual providers are recognizing, hey, this is something that's really important for us. I don't know what I'm doing. Help me, please. And so, now we have great things like the Center on Colfax has a whole day training to learn more about what you need to know to be competent working with LGBT populations. I think that that's a phenomenal resource that's been there. Some other ones that can be present in your local community can be through your own professional organizations. So with psychiatrists, it can be through the Colorado Psychiatric Society. And at the broader level, you can through the American Psychiatric Association or the American Psychological Association. Each of them have specific groups of experts that can provide some information about these. Fenway Health is a community health center in Boston. They have a whole website devoted to also education for healthcare providers. That can be a tremendous resource. A number of either free or paid videos that you can see there. So I think that we're really having a lot more options than we used to. I think that the next step forward will be for some of these to be more tailored to specific individuals. We can move beyond the 101, the 201, and we've started to see this. There's, okay, well, what do I need to know specifically about the intersection between, let's say, bisexuality and domestic violence? How are those things related in a particular way? that may be unique.
Mm-hmm. We had a comment from one of our audience members mentioning that their OBGYN asked about their sexual orientation and gender identity and the positive impact it had for them. Have you witnessed that yourself in your own practice, Dr. Chavez, when you've had that opportunity to ask people?
Absolutely. There's a number of times where people, they kind of stop, and sometimes I can almost tell that they're thinking, is this a trick question? Am I really being invited to talk about this in here? And there's quite a bit of relief on some people's faces when you bring this up, and you just say, whatever it is with yourself as a person, however it is, even if you don't really have a name for it right now, you're welcome to talk about in here. Mm-hmm. If you are feeling confused or unsure and you want to bring that in, you're more than happy to do that. And I've had other people in quite a different spectrum that found that they were generally discriminatory or opposed to LGBTQ individuals, or what they call the certain lifestyles. And they started to realize that if we can talk about these things, and if it's part of normal conversation and part of people's everyday life, then maybe it's not quite as strange or unusual as they thought, and maybe that's okay.
So it sounds like even in the act of having those conversations with people who may identify as heterosexual and cisgender, that even that very question opens up their thoughts around that. Would you say that's...
I think you're nailing it. I think you're nailing it right on the head there, Sable. That's a great way to summarize it, is that it's really opening people's minds to saying, oh, well, maybe I can talk about this with, is this a thing that people talk about? Maybe this is good for me to talk about. Maybe I want to ask some of my friends this. Mm-hmm. And perhaps even if they're not explicitly asking these questions, if one of their friends does start to talk about this, they say, oh yeah, that's something. It doesn't have to be a hush-hush conversation. Heck, I just talked about that with my doctor yesterday.
Yeah, I think overall culturally we could move forward a lot to be able to talk more openly and honestly about our sexuality and our identities and desires. What would you recommend for people who know bisexual and pansexual people in their life and want to be supportive around their healthcare? How can folks support people, the bisexual people in their life, talking to their physicians and their healthcare providers?
I would encourage them as much as they feel able to be able to bring up these topics. I think that if you know bisexual people and you want to support them better, some of the best things you can do is take the time yourself to read what might be helpful. What are these ways that I can support them? What's information that I might know? So that way you're not putting the burden on bisexual people to always be the educators about themselves. Some people may be more than happy to. Awesome. But it shouldn't be that just because they have this particular identity that you don't know much about, that doesn't mean that they're qualified or even interested to explain that to you. And I think that, touching on another thing that you were just mentioning, in about how much we talk about sexuality in general, I think that it's something that is a really big part of a lot of people's lives, but yet it's one of the things we keep most secret and the most private. And I think that certainly is not to our benefit. I think that if people were able to talk a little more openly about sexuality, perhaps if it didn't have to be so secret, people might not feel as stigmatized when they did bring it up.
Mm-hmm. And what would you say to bisexual, pansexual community members out there about pursuing more or better healthcare? What would you recommend for folks that are wanting to either find physicians that are supportive for them or talk to their own physicians?
Yeah, I think that ultimately my hope is that we can get to this space where there doesn't have to be specific LGBT health centers or LGBT specialty clinics. We just call them clinics because every place is equally competent and excellent when they're working with their LGBTQ patients. And I think that the truth is we may not be at that place yet. There's a lot of people that really don't know how to interact with their patients, or they may do a number of things with best intentions that don't pan out in the way that they had hoped. And so I think that currently, if you feel like you're not being supported by your healthcare providers, a specialty clinic may be helpful, such as, for example, the Imagine Clinic up in Northeast Denver, or some of the Denver Health Services. Those are both like medical areas. I know that there's a lot of other specialty mental health practices in the area, like Clear Asterisk. So that could certainly be something that could be helpful. But ultimately, I don't feel like it's the responsibility for you that you have to be cornered into something that's a specialty clinic just because you have this particular identity. And so sometimes bringing it up to your provider, if you feel like you're able to, can help stimulate that discussion or the conversation for your provider to go learn more themselves, for them to attend one of the trainings, or for them to look up some of these video lecture series to get more information that they need to best serve your health needs. Because ultimately, if you're the patient, the focus should be on you and what the providers can do for you, not what you can do for them.
Right. I wanted to open it up real quick to see if we had any questions from our viewers. If you want to grab just a quick drink of water, Dr. Chavez, because I know that I've had you been talking for about the past 15 minutes. So
For sure.
So if there's any questions from community members that are on right now, we'd love to. In the meantime, do you mind if I ask you a little bit about the work that you're doing at the VA? So can you tell us a little about that?
Sure. So at the VA, I started there about 6 or 7 months ago, and it was trying to combine a couple different things that I've worked on in the past, replicating some of the experiences of creating mental health clinics that I've done before, but really focusing on a broad population, even within LGBT individuals, that has historically encountered a lot of structural levels of discrimination. So between Don't Ask, Don't Tell, between the trans military ban, there are a lot of reasons why veterans justly feel uneasy about being very open about their sexuality or their gender identity, either within the military or within the VA. And so even aside from specific policies, there's also just what we call the de facto discrimination. There's the kinds of attitudes, a bit of machismo, if you will, that's can be a bit pervasive at times and can prevent people from feeling like they're able to be their whole selves. And so our goal focuses on multiple things. The first one is trying to identify how many veterans are there that have, as we call it in the VA, LGBT and related identities, and what are the ways that we can begin to reach them. I have some ideas of some of the programming that we can create for them, but that's not to say that I have all the answers or that I know it's best for all these people. Rather, we can start from some places that have worked in the past, such as creating a trans veterans group, as we've done recently, creating a group for broadly any LGBT individuals we call it Pride in All Who Served. It's a group that's similar to something that they've done at a couple different places in the country. And so we think about what are the ways that we can provide to the veterans, but also what are the ways that we can provide to the providers to give better care to the veterans. So we've also started an LGBT health lecture series that's available to providers all over the country that work with veterans to better understand what are some of the unique needs of LGBT veterans. How do these intersecting layers of discrimination contribute to health disparities, and how can we reverse those to better improve health outcomes?
Oh, that's wonderful. Thank you for all this work that you're doing, Dr. Chavez. And I want to thank you for being with us today. I think this is going to wind up being a short video, John. So I don't see any other questions. Thank you again for this work. And if there was anything, is there anything that you wanted to add, or maybe we have a question? How can one go about educating themselves about sex with a gender they've never been involved with? Are there resources to inform safe sex in this regard? What would you recommend, Dr. Chavez?
It's a great question. I think that oftentimes I say, regardless of whether people are just starting to involve in sexual activity or whether they're relatively more experienced in sexual activity and looking to start with new partners, Scarleteen is one resource that can be helpful to talk about anything that might be present there and what sex could be like, or sex with new kinds of partners. And so I think that could be one place to start.
Mm-hmm. I think we were supposed to have Denver Element here. They would be another good space to check in around safer sex practices and educate around that. Back a long time ago, if you can find it out there, I supported a Kickstarter with a little book called Girl Sex, which was kind of this really large book on having like sexual relationships with all sorts of feminine identified people. So there's some good resources out there as well. I think generally looking at your healthcare services and providers is a good source. So.
Yeah. And if you feel comfortable discussing it with your providers, whether it's your primary care provider, whether it's an OBGYN that someone might have, sometimes talking with them about what are some safe sex practices, I'm almost positive that they would be willing to have that discussion, because that kind of depends on whether the types of sexual practices are penetrative, what parts are going whether mouth is going in different places, whether it's a vagina, an anus, or different terms that we can use, front hole.
Another question. Some bi plus people are also polyamorous. Can you talk about making safe space for such people? Have you had experience working with polyamorous folks, Dr. Chavez?
Absolutely. So if we think about polyamory, some of the same safe sex practices can apply, but there's also some unique needs. Mm-hmm. For example, if you're using barrier protection, like condoms, either over yourself or over sex toys when you're engaging in sexual practices, if those should be changed when you're changing to a different partner, because otherwise you might be swapping fluids in a way that's not intended.
So I will say there is an organization in Colorado. I want to call, I believe they're called Loving More, if I recall. They're actually a Colorado local organization that talks about and promotes topics related to non-monogamy and polyamory. I believe they either have a magazine or I believe they still have a magazine. So they might be a good resource in terms of what looking at models for how to have supportive non-monogamous relationships. There are numerous books. I remember ages ago I read The Ethical Slut, which is a great book. I think the critical piece on that is communication, right? Mm-hmm. Talking to our partners. Mm-hmm. And I don't know if you can talk about the importance of being open and talking to our partners about these, Dr. Chavez.
For sure. And I think that also brings up the topic of being able to talk to your partners, not only about what kinds of sexual practices that they may be interested in or willing to do, but also what their sexual history is, their number of partners that they've had, maybe let's say within the past year, or to get a general idea of what your risk levels might be. What kinds of safe sex practices do they use when they're engaging with other partners? Have they been tested recently? Is that something that they are willing or interested in doing? And how about yourself? Have you been tested recently? Is that something that you think might be helpful going into your provider and asking about that? Mm-hmm. And then when we're talking about the different kinds of strategies that we use when engaging in sexual practices, the preventative type strategies, broadly speaking, there's prevention of pregnancy as desired, and there's the prevention of sexually transmitted infections. And so not all things are going to protect against the same thing for the same efficiency, right? Barrier protection, things like condoms, can be a relatively decent protection against both. There are other things that may be protective against pregnancy if that's something that's desired, including various kinds of hormonal contraception. But that doesn't protect against sexually transmitted infections.
Mhm. Great, thank you. Checking to see if we have any other questions. Give it a moment.
Another thing that people could think about if they're interested in engaging in safer sex and they're either concerned about their own risks or they just want to take an extra proactive step is they could talk to their healthcare providers about things like PrEP, like a pre-exposure prophylaxis, in order to reduce their risk of contracting HIV.
Can you say a little bit more about some of the positive impacts that you maybe have seen from wider access to things like PrEP?
Yeah, I think that if we talk about wider access to things like PrEP, wider access to things like condoms, condoms readily and easily being available in health spaces, really we see the rates of what they're intended to prevent, we see the rates go down, which is great. There's a lot of worry that, well, if we talk to people about it, if we give them this, then they're going to be having more sex or, gosh forbid, what's going to happen? And it really doesn't pan out that way. The fears generally tend to be unfounded. And so it's always in our best interest to make things more widely available and accessible because it can really have a significant impact on people to be able to prevent things that they don't want. I mean, it doesn't sound like rocket science, but somehow it often becomes a sticking point.
Exactly. I will have to say that I think our community overall is very grateful for PrEP, right? It has reopened, sort of like helped us address a lot of these fear of HIV transmission, but PrEP alone, as you were mentioning, is not enough. There are other sexually transmitted diseases that you would want barrier protection for and things like that. So
exactly. And if we combine these multiple things, then overall you're reducing your risk of everything.
Right.
Which
exactly.
is always cool.
Which is the goal, right? Preventative health rather than having to come in afterwards, right?
Preventative health is always much, like a promise, it is always much easier. It is always much more cost effective for both you and wherever you're getting served. It's always better, they say an ounce of prevention is worth a pound of intervention. So.
Great. Thank you for being with us this afternoon, Dr. Chavez. I had a really great conversation. I hope you have a really wonderful afternoon and a great weekend.
Thanks. It's always my pleasure to be here. I always like talking about these things.
Great. And thank you to all of our studio audience. Remember to like and subscribe and hit the notification bell because I think it's actually working now. So y'all have a wonderful afternoon.